The information provided in this podcast is for educational purposes only and should not be taken as medical advice. Before making a health decision, please consult with a qualified medical professional. Thank you for your attention and enjoy today's episode.
What's up, good people of the internet? My name is Tony and you're tuned into Hemp Nerd, the podcast that helps clarify how medical cannabis works so you can get reliable therapeutic results. Now, in today's particular episode, we're going to be answering the question, can you take CBD oil with prednisone? Now, for those of you unfamiliar with the Hemp Nerd podcast, what I normally like to do first is understand the problem or understand the question. So in this case, we're going to be looking at prednisone first, understanding what it is, how it interacts with your body, and then we're going to shift the conversation to seeing whether or not you should be taking it with CBD oil. And hopefully by the end of this episode, I would have earned your subscription. However, for those of you familiar with the process, familiar with Hemp Nerd, let's get to it. Alright, so we're just going to kick things off by answering the most obvious question that we can, which is what is prednisone? And of course, everything is going to be coming from my blog because I've written about this already. If you prefer to read versus watch me or listen to me speak, because this is also in audio format as well, you can just head on to HempNerd.co and you find the blog there. Can you take CBD oil with prednisone? However, if you like this interactive experience, let's get into it. So prednisone is a synthetic corticosteroid. A corticosteroid is a steroid hormone that is either naturally produced by your body or synthetically man-made. Now, synthetic corticosteroids mimic the actions of naturally occurring corticosteroids. They're used in people with adrenal glands that are unable to naturally produce adequate amounts of corticosteroids. Now, there are two types of corticosteroids. One, namely gluco-corticoids, and the other one is mineralo-corticoids. Gluco-corticoids are mainly used to suppress inflammation and immunity, as well as break down fats, carbohydrates, and proteins. Now, mineralo-corticoids are mainly used to retain salt in your body, as well as regulate your internal balance of salt and water. Between the two types, prednisone is a synthetic gluco-corticoid. Now, the next question on our list there is, what conditions is prednisone used to treat? So prednisone is used to treat a wide variety of conditions, right? So here's my list so far, but this is obviously not the entire list. But obviously there's rheumatic disorders, so something like psoriatic arthritis, rheumatoid arthritis, bursitis, gout, osteoarthritis, and the list goes on there. You've got skin disorders as well, so like any severe allergic reactions, mycosis fungoides, a form of lymphoma, psoriasis, and a few other conditions there as well. Obviously, if you want the full list, again, head to the blog. Then you've also got gastrointestinal diseases like Crohn's disease, for example. You've got hormonal disorders, so any adrenal insufficiencies, as we mentioned earlier, of course, that it's used in people with adrenal glands that don't produce enough naturally occurring corticosteroids in the body. You've got skin disorders as well. So any no, I've actually covered that one already. Skin disorders, allergic reactions, eye disorders, respiratory disorders, so tuberculosis and pneumonia. They can use prednisone for that as well. Blood disorders and multiple sclerosis, and obviously with blood disorders we're looking at things like anemia, right? So in short, and this is the way I see it at the moment, prednisone is used to treat almost every condition you could possibly think of, right? The most highlighted benefits of prednisone treatment are its anti-inflammatory and immunosuppressive effects. However, prednisone is a drug that I personally believe you should stay away from if you can, because it comes with very severe negative side effects, which we're about to get into now. So, what are the negative side effects of prednisone? So before I get into obviously the full gamut of what this list looks like, what you need to know is the problem with prednisone and other synthetic corticosteroids is that itself, the severe negative side effects that they come with. According to an expert an expert comment that I found on the Johns Hopkins Arthritis Center website, the person said that there is no safe dose of prednisone. Prednisone over time increases the risk of cardiovascular disease, osteoporosis, and infection. It can worsen underlying diabetes and hypertension. The effects are dose related, and the higher the dose, the worse the side effects. So and that's a key point to remember as well. I'll tell you why when we come to basically talking about whether you should take CBD oil with prednisone, but that's a key point to remember, that the higher the dose, the worse the side effects with prednisone. So prednisone should be minimized, but current thoughts are to try to eliminate it completely. So this is an expert at the this is what an expert is saying at the Johns Hopkins Arthritis Center. So in my understanding, I believe that's a doctor saying that, but the person didn't say that they were a doctor, and they were responding to a patient who was asking questions about how they should be taking their prednisone. The negative side effects of prednisone that occur at the onset, and this is just at the onset, right? And obviously depending on who you are and your biochemical makeup and all that jazz, but you're looking at basically high cholesterol, weight gain, increased sweating, facial flushing, nausea and vomiting, nosebleeds, oral thrush, sore throat and coughs, trouble sleeping, acne, blurred vision, water retention, mood swings, thin skin and easy bruising, delayed wound healing, stomach irritation, muscle weakness. You'd be more susceptible to infection and stunted growth in children. And the more severe negative side effects of prednisone likely to manifest over long-term use is loss of bone density, so that's osteoporosis, high blood pressure, so that's hypertension, diabetes or worsening pre-existing diabetes. So if you've got diabetes already, this medication is actually going to make it worse. For anyone listening, I actually put air quotes there. Clouding in your eyes, so cataracts as well, stomach ulcers, depression, Cushing syndrome. Never heard of that before until obviously I was researching prednisone, and glaucoma as well. Now, long-term use is actually defined as any time frame that exceeds 3 months, right? So as you can tell from the lists of this side effects, they become extremely severe with obvious long-term use. Your doctor will recommend a daily vitamin D and calcium supplement to counteract some of the negative side effects. However, supplements are recommended if you take synthetic corticosteroids for more than the 3-month period. Due to the severely negative side effect profile of prednisone, there are a lot of patients out there looking for alternative treatment solutions. One of those solutions being considered is actually cannabis therapy, which brings us to our question of the day. And that was pretty quick. Normally it takes us a while to get here, but because we're not looking at a condition, we're looking at a medication, and the question people are having is, can they take prednisone with CBD oil? We're about to find out. And side note, just before we get into that, and the reason why, there's 3 reasons in my mind why someone is considering taking CBD oil with prednisone, right? The first reason is obviously to negate a lot of those side effects, or as much of those side effects as possible. Or when I say negate, what I'm really trying to say is counteract some of those side effects, or cancel them out. Another reason is maybe withdrawal. Now, there are withdrawal symptoms from prednisone, but the list isn't that crazy for me to get into. But there are a lot of medical professionals that do say that it's not a drug that you can just stop taking and then all will be good. Your body is going to have some kind of withdrawal symptom reactionary. It's going to go into some withdrawal symptom reactionary state. And I don't know how long that state lasts for, because every single person is different. Everyone's biochemical makeup is slightly different. But that's the second reason why I believe someone would be wondering, can I take CBD oil with prednisone to basically wean themselves off prednisone. Third reason, because I did say 3, I can't think of a third one. I did have a third one in my mind, but I've actually drawn a blank. But anyway, if those are 2 reasons, to wean themselves off or to counteract the side effects. Yeah, I guess there's only 2 reasons. Man. Anyway, let's move on. So the question of the day is, can you take CBD oil with prednisone? Can you take CBD oil with prednisone? From a safety perspective, my answer is no. You cannot, you should not. It's not a good idea. However, from just a pure mechanical perspective, where you're just saying, can I take it? Can I take this with this? Of course, like, yeah, you take one, you take the other one, done. But again, we're looking at safety here. We're looking at the safety perspective, and clearly the answer is no. I mean, yes, of course you can physically take them together, but the results will not be as positive as one may hope, because you might tell yourself a fantasy that CBD oil might be the cure-all and might be something that can counteract some of the negative side effects. But this is where understanding how these drugs or these chemicals or these substances actually work in our body actually comes in handy for someone making that rational mistake in their mind, thinking that things are going to be okay. But if you're someone who's looking at maybe negating the side effects, weaning yourself off prednisone, there is a strategy that I'm going to go into as well that pro-cannabis doctors actually recommend to kind of help you to say you're taking them together but not at the same time. And if you're familiar with my content, if you've been reading my blog, then you do know what this strategy is. But obviously for anyone who is new here, who has no experience with Hemp Nerd and what I've been talking about or what I'm writing about at the moment and what I'm putting together, then this is actually going to be very valuable information for you. So first things first, how risky is it to take CBD oil with prednisone? So, of course, the main concern people have is whether CBD oil can be taken with prednisone and whether that's going to cause any negative interactions when you take the two together. The risk of negative interactions is more real than you may realize or believe. And the reason is because up to 80% of all pharmaceutical drugs are broken down by a specific enzyme in our liver called cytochrome P450. So this enzyme also breaks down CBD and THC in our body. So CBD, THC, and prednisone will all compete for the same metabolic enzyme to be broken down for distribution within the rest of our body. So if you take CBD oil with prednisone at the same time, you actually risk ending up with an overabundance of prednisone in your system, because again, CBD, THC, well, even if there's no THC, right, you're taking a broad spectrum CBD. Your CBD is still competing for the same metabolic enzyme as prednisone, and there is a very high likelihood that CBD will block prednisone from being broken down, from being metabolized in your system, which will lead to an overabundance of prednisone in your system. And remember when I said you need to keep that line in your mind of the higher the dose, the worse the side effects, from that medical professional from the Johns Hopkins Arthritis Center. This is where that comes into play, right? So if there's an overabundance of prednisone in your system, because you've taken CBD oil and prednisone at the same time, which is a very high likelihood of happening, again, because they are broken down by the same enzyme, then you are more likely to experience heightened negative side effects, or a more severe negative side effects. So that whole entire laundry list of side effects that we went through, the negative ones that prednisone present, even just by itself without any competition happening in your body, that's going to be heightened because there'll be too much prednisone in your body. So that's the risk. That's the big fat risk that you take. I mean, taking prednisone by itself is a risk in itself, but then when you add CBD oil or any other medication, right, you're just increasing that risk, and you're increasing the likelihood of you experiencing those negative side effects. It's a very, very bad idea. So based on what I can, just that point alone, and there's no other points to get into, is because we're looking at what's going to happen in your body. That's what's going to cause a negative reaction. So to summarize, if you taking them together is a bad idea and very risky, because both CBD and prednisone are broken down by the same metabolic enzyme, cytochrome P450, and there's a highly likelihood of CBD blocking prednisone from being broken down. And when that happens, there'll be an overabundance of prednisone in your system, in your body. And when you have an overabundance of prednisone in your body or in your system, then you're going to increase the amount of negative side effects, as per even what the medical expert from the Johns Hopkins Arthritis Center mentioned, who was giving advice to a patient. So not a good idea, okay? Can you safely take CBD oil with prednisone? Is there like a workaround, like a strategy you can use? And this is something I alluded to earlier, obviously, in this podcast. Now, it depends on your goal. If your goal is to wean yourself off prednisone or reduce the impact of the negative side effects or even reduce the impact of the withdrawal symptoms, there is a safe way to do that. All right, there is a safe way to do that. What most pro-cannabis doctors recommend is actually the following steps, or the following strategy broken down into these steps. So the first step is spacing out the time between your drug administrations, and I'm gonna go into more detail with each of these steps, but spacing out the time between your drug administrations. Second one is microdosing your cannabis treatment or your cannabis therapy, especially at the beginning. Third is slowly increasing your cannabis dose over time. So you're not just like giving yourself too much, just slowly increasing it over time. Tracking and journaling your treatment actions and results. So how much you're giving yourself, how you're doing that, and then you're tracking that in a book somewhere, in a journal, and then you're also writing what your results are. And then consulting. Now this is my personal favorite strategy, although there is low supply, which is consulting with a pro-cannabis medical professional. As we all know, pro-cannabis medical professionals are few and far in between. Even though we do have the internet, and let's say you can start consulting with a medical professional in a different country thanks to the magic of the internet, it's still a challenge, because even that doctor has a workload of patients within their own country that they need to deal with. So, if you're the type of person who wants to take matters into your own hands, this is like the overview of what you should be looking at if you don't have a pro-cannabis doctor. Spacing out your time, microdosing, slowly increasing, and tracking and journaling your actions and results. The bonus really is finding a pro-cannabis medical professional. Now let's get into a bit more detail with those strategies. So the first one is to space out the time between your drug administrations. So as we discussed earlier, due to the fact that prednisone and CBD oil, or should I say CBD, use the same metabolic enzyme to break them down so they can be distributed to the rest of your body. From all the reading that I've done over time, most of the pro-cannabis doctors recommend actually spacing out the time between each medical administration. So maybe you can, depending on what your goal is, you could either start, in my books, I would start with CBD oil and then move to prednisone, because that's the safer of the two, and I'm going to get into that as well. But then I don't know, you could be the opposite. You could say, okay, I want to start with prednisone first and then move to CBD oil. Whichever one you start with, you need to give a time frame of, and what I've found is doctors generally recommending around 1 to 3 hours between your administration before you have the next one. So if you start with CBD oil, wait 1 to 3 hours and then take prednisone, or vice versa, right? You start with prednisone, wait 1 to 3 hours and then take CBD oil. So the reason, of course, that why you should do this is because you're giving your body time to metabolize the first drug, and then once it metabolizes the first drug, you can take the next one, and there's no competition happening in your liver. There's no competition happening for the attention, we'll call it, again air quotes, for the attention of your cytochrome P450 to break down that particular drug that you're taking, because that's where, again, up to 80% of all drugs are broken down. So it gives your body enough time to break each one of them down and then distribute them, causing preventing any negative interactions, but in this specific case with prednisone, preventing the likelihood of you having an overabundance of prednisone in your system. All right, the second strategy that pro-cannabis doctors recommend is microdosing. So if you're not familiar with microdosing is a practice of taking the minimum amount of a given substance to achieve your desired results or effect. All right. So with respect to CBD oil, people consume very small amounts throughout the day to achieve results such as reduced anxiety, reduced depression, pain relief, and anti-inflammatory effects. Doses can be as low as 2 to 3 milligrams to start, with the average dose range being around 3 to 10 milligrams. So what microdosing enables you to do is to experience the benefits of CBD oil without, let's say, if you're taking a full spectrum, because there's some people who are worried about, or will I get high when I take CBD oil, and they've only got access to a full spectrum product. When you're microdosing, for example, when you're microdosing that type of CBD oil product, that is a full spectrum. It's got a heavy, depending on where you're getting your CBD oil from, it's got a lot of THC, or it's got enough THC to make someone high. When you microdose, you can experience the benefits of CBD, even that THC interaction, because CBD and THC have been shown to provide very effective pain relief effects, even in cancer patients. You can experience those anti-inflammatory effects, those pain relief effects. If you're dealing with rheumatoid arthritis, those immunosuppressive effects or anti-arthritic effects without getting high. Now, the third strategy is that doctors recommend, pro-cannabis doctors recommend, is to slowly increase your dose over time, all right? So in a practical setting, this means increasing your CBD oil dose slightly every couple of days while paying close attention to the effects that you experience. So for example, you can start, if you start to feel lethargic or dizzy after a dose increase, then you should actually reduce that dose slightly to the point where you do not feel dizzy or lethargic anymore. Then you can stay at that reduced dosage for a few days before attempting to increase it again, because maybe your body wasn't ready for that adjustment, or it was too much, it was still tolerating that initial one. So there could be a few reasons there. But then the last two strategies play really well into the third one, or the fourth one, should I say, which is tracking and journaling your actions and results. So you're going to be tracking how much you're microdosing by. You're going to be tracking how often you take it during the day. You're going to be tracking how you feel. This is how you're going to know whether you're getting the positive results from taking CBD oil or any negative results from taking CBD oil. But tracking and journaling is extremely important, because this is such a new regimen of medication, and the current establishment is not exactly pro-cannabis. So a lot of people, and that's why you're watching this, but a lot of people are taking matters into their own hands. However, then I personally believe that there are smart people, doing the right thing, and everything I'm talking about, they already know, they're already practicing. But I personally believe for every smart person, there's 9 not so smart people, and that's why I'm putting this content out. Maybe there's I'm not saying anyone's dumb here, but I've seen stupidity. I've seen human stupidity. I've seen people make stupid decisions, and I've been one of them. I've made stupid decisions as well. So this is my way of trying to eliminate that as much as possible. If you're searching for this kind of information, you happen to come across my content, hopefully me putting this together in this format actually allows you to understand how you should approach it if you are taking matters into your own hands, and if you do not have access to a pro-cannabis medical professional, which I highly recommend you find, because I'm not one, but I'm doing my best to make their job easy when you do find one. I'm making sure that, the reason I'm doing this as well, another reason why I'm doing this is making their job easier, right? I'm making sure that you do the right things from day one. When you start taking matters into your own hands, you're microdosing, you're slowly increasing, you're tracking your actions, you're tracking your results, you're tracking the concentration, you're tracking whether it's broad spectrum or full spectrum. You're keeping a tight lid on exactly what you're doing. Your process is airtight. And then when you eventually do find a pro-cannabis medical professional, when the establishment catches up, and then more doctors are comfortable and familiar with medical cannabis treatment or cannabis therapy, doing this is going to make their job easier as well. So that's my hope with this process. Anyway, rant over, let's get back into it. It will enable you to keep a close eye on how your body actually responds. That's a very good point. So this process of tracking and journaling your actions and results will enable you to keep a close eye on how your body responds to your CBD or your treatment or your cannabis therapy relative to the condition that you are treating for, because obviously this works for a lot of conditions. Everyone's dealing with something else, but CBD oil seems to be one of those things that can treat a lot of conditions. Cannabis can treat a lot of conditions. So doing this tracking and journaling also enables you to instantly tell when you slip from positive to negative results and what it took to get there. So there'll be no guesswork with this process. And of course, the fifth and final strategy is to consult with a pro-cannabis medical professional. Be it a doctor or a nurse, it's always better off working with a professional, someone who knows what they're doing, someone who's been trained in this field. Now, this particular strategy can be challenging for a lot of patients because the laws are still in a kind of like a legal gray area depending on where you live on the planet. Again, because of the internet, you do have access to doctors around the world, but then again, the challenge is to find one who's actually going to consult with you and provide you guidance along your journey to recovery, because they have a patient workload that they need to deal with within their own country. So they've obviously got enough work for them to deal with, especially even with what's going on at the moment in the world. Everyone is talking about, you know, the COVID-19 and all that jazz. So obviously doctors have got a lot on their hands, and nurses have got a lot of that on their hands at the moment. So this particular final strategy, even though it's near and dear to my heart, is, I think, the most challenging one. I could be wrong. You know, I could be seeing things very differently from reality, but that is something I'd recommend you do. Find a doctor, because they are professionals in, obviously, medical treatment, especially pro-cannabis medical professionals. That's where you want to be. Now, here's an interesting question that popped up in my mind when I was researching this topic, right? Can CBD oil treat inflammatory and autoimmune diseases better than prednisone? Because at the beginning of this episode, we went into what prednisone is used for, and I saw a lot of inflammatory diseases or conditions, and I saw a few like autoimmune diseases that were mentioned like through my research, like rheumatoid arthritis, and I've touched on that, and that triggered something in my head. So when I pose this question, can CBD oil treat inflammatory and autoimmune diseases better than prednisone? I believe the answer is yes, and I'll tell you why. So we already know that prednisone is used to treat a large variety of conditions, and its main touted benefits, right, are its anti-inflammatory and immunosuppressive effects. So those are the two benefits that it comes with. However, the list of negative side effects it overshadows those two benefits. Like for those two, it's anti-inflammatory, it's immunosuppressive, but then all these other things can happen, or will happen actually, because one doctor even said, hey, this thing, don't even touch it. But all these other things will happen. It's got a massive list of negative side effects versus two positives. So to answer this question, whether CBD oil can actually treat inflammatory and autoimmune diseases better than prednisone, we actually need to look at the results of two studies. One is a 2000, it was done in the year 2000, a collagen-induced arthritis rodent study, and a 2005 rheumatoid arthritis patient study. So I believe that the results from these studies will help you see how much better CBD oil is versus prednisone. And then after this, I'm actually going to do something which was meant to be a standalone piece of content, but I managed to squeeze it in, which is we're going to look at the side effects or the side effect profile of CBD. So firstly, in the year 2000, a rodent model study was conducted to determine the effectiveness of cannabidiol, CBD, treatment in mice with collagen-induced arthritis. Now, arthritis is one of the major conditions that prednisone is used to treat. So this fact helps provide a comparative validation of results the study presents as it relates to prednisone treatment versus cannabis treatment. After inducing arthritis in the mice, CBD was administered as soon as signs of clinical symptoms were evident in the mice, of course. Now, the mice were administered with CBD daily for 10 days, either through injection or orally. The mice that received CBD via injection were broken down into the few groups. Group 1 of the mice received 20 milligrams per kg. Group 2 received 10 milligrams per kg. Group 3 received 5 milligrams per kg, Group 4 received 2.5 milligrams per kg, and Group 5 received 0 milligrams per kg. So they were the control group, they had no CBD. And the mice that received CBD via oral administration, which is what we're kind of used to, used to seeing, where you put drops under your tongue, they were broken down into the following 4 groups. Group 1 received 10 milligrams of CBD, Group 2 received 25 milligrams, Group 3 received 50 milligrams, and Group 4 received 0. So again, they were the control group as well. So the study found that daily administration of CBD in mice with collagen-induced arthritis in both modes of treatment effectively blocked the progression of arthritis. So it didn't matter whether it was through oral administration or through injection. CBD was effective in both modes of treatment. The study also found that CBD was equally effective for treatment, which is what I've just said, whether it was administered through injection or orally. The optimal daily dosages for the mice was 5 milligrams per kg through the injection. So that was the best performing one, 5 milligrams per kg through the injection, and then 25 milligrams per kg through oral administration, which is interesting. So the study highlighted that the clinical improvement was associated with the protection of the joints against severe damage, which was very interesting that CBD can actually do that. The data uncovered in this study shows that CBD has a potent anti-arthritic effect through its immunosuppressive and anti-inflammatory actions. This suggests that CBD is a valuable form of treatment for chronic inflammatory diseases. So again, those are the two things that are touted about prednisone, right? Prednisone, anti-inflammatory, immunosuppressive, right? But then prednisone doesn't have anti-arthritic effects. Like no one says it does, and in fact, it even it brings on a lot more conditions. It weakens your bones and weakens your muscles, and it makes your bones brittle and even makes your skin worse. Like you bruise easily, and it takes a while for you to heal. Where here, CBD oil or CBD in the mice, one of the things they found was, where is that? It was associated with the protection of the joints against severe damage. So CBD is protecting joints, and then it's being anti-arthritic through its anti-inflammatory and immunosuppressive effects or actions. So direct opposite. In the year 2005, a rheumatoid arthritis patient study set out to investigate the effectiveness of cannabis-based medicine called Sativex. The study's focus was on pain relief effects that Sativex could provide the patients. However, it is worth noting that rheumatoid arthritis is an inflammatory autoimmune disease that causes joint damage, joint pain, inflammation, swelling, tenderness, and stiffness throughout the body. Now, Sativex is a cannabis-based medicine with a 1-to-1 ratio of CBD and THC dominating the solution, and Sativex contains other minor cannabinoids as well, so it's a full spectrum product. And Sativex and a placebo were administered to a group of about 58 rheumatoid arthritis patients over a period of 5 weeks via oral mucosal spray. So they were spraying it under the tongue, I believe. 31 patients received Sativex, 27 patients received a placebo. So results from the study showed that patients who were administered with Sativex displayed a significant improvement in the following areas. So pain on movement was reduced, pain at rest was reduced, quality of sleep was improved. All right. However, what was more interesting is that the arthritis activity was significantly suppressed following Sativex treatment. Again, rheumatoid arthritis is an inflammatory autoimmune disease. So this suggests that Sativex not only showed pain relief effects, but anti-inflammatory effects as well. And the study highlights that the suppression of inflammation or the suppression of inflammatory activity indicates an influence on the immune effector system. This is consistent with the results from the rodent model study that we covered earlier, just before this, where CBD suppressed the progression of arthritis in mice. So again, it does the same thing in human beings. First, in mice, they found out in the year 2000 that CBD has, and let's just call it, anti-arthritic effects. And then in 2005, again, it's been discovered that CBD in humans has the same anti-arthritic effects, even in rheumatoid arthritis, right? We're not looking at osteoarthritis, we're looking at rheumatoid arthritis, which is just, I wish that upon no one. It has anti-arthritic effects. Now, the next big fat question we need to answer is, what are the negative side effects of CBD oil, right? Because it's not fair to look at just the negative side effects of prednisone and then look at the positives of CBD or cannabis and just say, yeah, CBD is better. Like, we need to do a one for one or 1-to-1 comparison. So we need to look at what the negative side effects of CBD are to, I guess, have a clear understanding. So to answer this question, we need to look at the results of a 2017 clinical review journal and a 2020 meta-analysis systematic review. The results from these reviews or these journals will help you or help us understand just how safe cannabis therapy is compared to prednisone. So in the year 2020, this year, at the time of recording this particular episode, researchers conducted a systematic review and meta-analysis of the adverse effects of CBD in patients with varying conditions. The researchers looked at randomized, placebo-controlled clinical trials lasting longer than 7 days. They reviewed 12 clinical trials with a total of 803 patients to glean data from. The researchers found the following negative side effects with CBD: solemnness, so sleepiness or drowsiness, diarrhea, sedation, abnormal liver function, and pneumonia. All right, so 1, 2, 3, 4, about five, and compared to, I don't know, 50 from prednisone. However, here's something interesting that you should know. The researchers pointed out that, and this is in their words, right? Associations with abnormal liver function, solemnness, sedation, and pneumonia were limited to childhood epilepsy studies, where CBD may have interacted with other medications such as clobazam or sodium valproate. I think that's how you say that. So basically what they're saying is the reason why those negative side effects showed up, the reason they believe those side effects showed up is because of drug interactions. And we've discussed that already in this particular episode, where about 80% of all pharmaceutical medication is broken down in the liver, or the liver enzyme with cytochrome P450. So they're saying because and this was only showing up in child epilepsy studies, so those children were already taking other forms of medication. And again, it says abnormal liver function. So think about it, right? Abnormal liver function. If you think about that for a moment, again, everything is broken down. Well, about 80% of medication is broken down in your liver by an enzyme called cytochrome P450. If you're already taking medication, that's what's going there. And then if you add CBD on top of that, they start competing to be broken down by that enzyme. Either you're going to have an overabundance of CBD or an overabundance of that medication. Highly likely you're going to have an overabundance of the medication that you're taking, and that is what's going to contribute to abnormal liver function, because now I don't know if you're exhausting your liver, or you're overexerting your liver, or there's just not enough enzymes to break down everything, so your liver gets overwhelmed. Who knows? But those were they found abnormal liver function tests. So, and they also attributed the solemnness, the sedation, and the pneumonia to that. That was a result of that interaction or that competition in your liver. So what the researchers did, because they were reviewing previous studies, they excluded the child epilepsy studies, and they found that the only negative side effect associated with CBD was diarrhea. That's it. So the researchers concluded, stating that the available data from clinical trials suggests that CBD is well tolerated and has relatively few serious side effects. However, interactions with other medications should be monitored carefully, which is basically the moral of this particular episode. If you're thinking about taking CBD with prednisone or CBD with insert drug name here, think about your liver function. And the enzymes in your liver, that's its job is to break down those medications into simpler forms so they can distribute in your body. If you overwhelm your liver with too many drugs, right? You take CBD oil, you take prednisone, you take aspirin, you take all these things. Of course, yes, abnormal liver function, definitely. But then you're going to have an overabundance of drugs in your body, and then all these negative side effects are going to start showing up because your body doesn't know what to do with them. They haven't been broken down, they're just there. So that's something to think about. I think that's the main takeaway from this particular episode. Now, let's keep moving. In 2017, researchers set out to update results from a 2011 review regarding the safety and side effects of CBD. The researchers' focus in this review update was on clinical studies and potential interactions CBD had with other drugs. The majority of the clinical studies reviewed in their update were for the treatment of epilepsy and psychotic disorders. In these studies, the most common negative side effects reported were tiredness, diarrhea, and appetite or weight fluctuations. Again, diarrhea seems to be consistent. It seems to be like the only negative side effect associated with CBD. And I don't even think it comes from CBD. This is my personal opinion. I think the diarrhea comes from the carrier oil that the CBD has been put in. So maybe your body doesn't respond well to. Maybe it's MCT oil, olive oil. What's the other oil that? Those are the two main ones that pop in my mind. There's a third oil, that hemp seed oil. So hemp seed oil, MCT oil, or olive oil. I personally believe that's what causes diarrhea, not the CBD itself, because I've never heard a stoner say that they got so high that it caused them to have a lot of diarrhea. Never heard that before, and I've got a lot of stoner friends. Never come across it before. So that's where I believe that's coming from. But until we can get some research and data to actually prove that, until, I don't know, maybe one day I'll get rich enough to actually do that experiment, or I don't know if I can do that study. That's the word I'm looking for. Do that study, then to actually collect the data and then present it to you. Then yeah, we'll be able to see that for ourselves. But yeah, out of everything they've looked at, so they've looked at how many did they looked at a lot of studies, and they were updating the safety study from 2011. Yeah, tiredness, diarrhea, and appetite or weight fluctuations. That's about it. That's what you'd call a negative side effect. Whereas prednisone has, again, 50 negative side effects, or 100 different crazy side effects. So the researchers stated that in comparison with other drugs used for the treatment of these medical conditions, CBD has a better side effect profile. This could improve patients' compliance and adherence to treatment. The researchers concluded their review by stating that CBD's safety profile is already established in a plethora of ways as being favorable for patients. Thus, various areas of CBD research should be extended to close knowledge gaps and have a completely well-tested compound, which is a statement I highly agree with. Like, instead of debating whether it's good for us or not, which we know it is, all right, the establishment is just trying to fight against that because they know that's going to empty their pockets, so to speak, or empty their bank accounts, or empty their pockets. It's going to dry up their income. We should be, the conversation we should be having and the actions we should be taking is to just to clearly understand how it works and close any knowledge gap that we have, so we can, I guess, reinvent or innovate the medical industry with this plant, because I personally believe the cannabis plant is a pharmacy in a plant. We just need to learn how to harness it properly. So in closing, where do we land? Where do we land with this? Where do we land? I personally believe it is extremely dangerous. It's extremely dangerous for you to take CBD oil with prednisone. In fact, I even personally believe it's dangerous to be taking prednisone. But again, I'm not a doctor. I'm someone who's researching this information to find the answers for myself and anyone else who's interested. But when I see prednisone, I'm already like, nah, danger, right? Now, due to CBD, THC, and prednisone competing for the same metabolic enzymes in your body, causing an overabundance, that's what's going to cause a lot of problems when you take them together. Not only is prednisone pretty, dangerous by itself, but having, taking it with something else that's going to prevent it from being broken down is just, to me, it's just a dumb move. We shouldn't be doing that. If anything, the closest you should come to is the strategic approach that we mentioned earlier, that we talk about, spacing out the time between taking them and everything else that we spoke about already. However, I personally believe CBD oil is a way safer alternative to prednisone for treating any inflammatory and autoimmune conditions, some of which I've already covered on this podcast and on my blog, HempNerd.co. If you want to check them out, just go there and you find them. It is effective and useful for providing anti-inflammatory, immunosuppressive, pain relief, even anti-arthritic effects. The studies highlighted in today's episode clearly demonstrate just how effective cannabis therapy is for treating these kinds of conditions. So there should be no doubt in your mind moving forward that you will be able to achieve effective treatment using CBD oil or cannabis therapy in general. Your only challenge now is actually finding a suitable CBD oil solution that will assist you in getting results. Now, what I have done is I have partnered with 4 companies, namely New Leaf Naturals, Pure Hemp CBD, Spectra, and CBD Sky, through an affiliate relationship, whereby if you make a purchase following my link on hempnerd.co/CBD shops, I will be able to make a commission from that sale. It will not cost you anything extra if you went by yourself via Google to these websites and made a purchase. The price is going to be exactly the same. The only difference going through my links and purchasing through my links, of course, is that you actually be supporting Hemp Nerd on a financial level, so I can keep coming back to you every week and presenting this information so you can make smart and clear choices about how to use CBD to treat your conditions if you're the type of person who takes matters into your own hands, purely because the establishment right now is not really supporting. Maybe it is, maybe things have changed. I haven't looked in a while, but the last time I checked, they're not really supporting cannabis therapy or cannabis treatment. And there are a lot of doctors out there who don't know or don't want to know for whatever reason. So yeah, if you go through that process of purchasing through my affiliate links on at hempnerd.co/CBD shops, you'll be supporting me, so I can obviously keep the lights on, put food on the table, and come back every week and provide this service of bringing this research and data and this information to you to help clarify how medical cannabis works, so you can actually get reliable therapeutic results. All right. So yeah, those are 4 companies I've vetted. There's a buying criteria that I set out. One of which is they should be doing third-party lab tests. They should be having those results published on their website for anyone to download and go through. They should provide international shipping, and they should provide discreet packaging as well. So that's the criteria that I have, and obviously they should have good customer service, but that's very subjective because everyone and every day is different. But those 4 core ones I personally believe are super important for anyone, because even with the third-party lab tests, you should be able to see not just the concentration levels of the CBD, but also the purity, right, or just how clean. So there's no like pesticides, herbicides, and foreign metals. It should be a clean product. So that's the criteria. My initial research led me to these 4 companies, and as long as you are purchasing through those links, then my relationship will be ongoing with these companies. However, obviously, if nothing's happening, then the relationship will fall out. Not to say that I can forge new ones or I can go back, but for the moment, if you found this content and you're in the market to purchase some CBD oil, then I highly recommend that you actually go to hempnerd.co/CBD shops. That's hempnerd.co/CBD shops. Click one of the links to one of the companies there and make a purchase. The price is going to be exactly the same, except that you'll be helping Hemp Nerd stay alive. All right. So that is today's episode. Hopefully it was very informative, very insightful. Hopefully you've got some practical strategies for you to use. If a lot of this information went over your head, I highly recommend that you either watch or listen to this again, depending on your preferred way to consume this content, because there is an audio form as well as a video. If you prefer to read, go to hempnerd.co. You will find the blog post that with the exact same title, Can You Take CBD Oil with Prednisone? And you can actually read what I wrote, because that's exactly what I was doing to present this information to you, with a few thoughts of my own thrown in to make it a bit more interesting. Yeah, other than that, hopefully if you're new, hopefully I have earned your subscription today. If not, I will catch you on the next episode of the Hemp Nerd podcast. Peace.